All right, hello ladies. My name is Nicholas. I'm going to be your nurse today. I just want to describe and explain the medication that was prescribed to you. I know that you're an ER physician and you've been dealing with a lot of stress, and that's maybe been causing you some chest pain early in the morning. So the provider actually prescribed Amlodipine. So this is going to help with that blood pressure and chest pain. And it's also called Norvasc, but it's normally just called Amlodipine.
I've heard it's for like blood pressure, so I'm not sure how like the blood pressure pill is gonna help me with my chest pain though.
No, yeah, that's a great question. It does lower your blood pressure, but the specific name for this medication is a calcium channel blocker. And so in simple terms, it's just gonna relax those smooth muscles around your heart. And then this is gonna prevent, spasms and what's causing that pain from the spasms. And so this spasm is called variant angina. So it's going to just help relax that heart and make sure that you're not in any more pain.
Okay, sounds good.
And so you'll be taking a 5 milligram dose in the morning, and you're going to be taking it every morning around 9 o'clock a.m.
Is it important that I take it at the same time?
Yes, so it is very important that you take it at the same time every day.
Does she have to take it with food?
She actually does not need to take it with or without food. It's not really important for that, but the consistency is the more important thing. Just taking it at the same time every day, just to make sure that you have that full protection and the levels don't drop in any way. Do you mind actually showing me how you would typically take this pill in the morning?
So you said take it like right there with or without food, and then just like swallow it whole.
Yes, and normally with a glass of water, that'll help. All right, perfect. That was really good. And I would also avoid taking it with any grape juice, just because if you do take it with grape juice, it's kind of gonna block the breakdown of that medication, and that could cause very toxic levels to rise.
Oh, okay, good to know. Thank you. And I love my grape juice, so that's good to know.
Yeah, unfortunately, no grape juice in the morning.
I know. Oh my lord, I love that.
No, there's some other options.
No wine.
No alcohol, just plain glass of water will be fine.
Yeah. My friend knows how much I like my wine though, so.
Yeah, and a lot of people like wine. I'm a big fan of wine as well, but not with this medication.
It's okay.
So before we go any further, I did see that you have a penicillin allergy.
I do, yes.
Are you currently taking any herbal supplements, any over-the-counter meds, or any prescriptions we haven't discussed?
Well, I do take multivitamins, but I did discuss it with the physician though.
Okay, that's great. Just always check in with us if you're adding anything new, any new herbal teas, just because that can sometimes affect how the amlodipine works.
Okay.
And also, I did see that you do have a smoking history.
Yes.
So it's going to be really key for you to stop smoking, just so you can, help with the medication, but also that should relieve some of that pain as well.
I know. I've been trying to quit, nurse. I know she's been on my behind for a long time about quitting. I'm trying though.
And you stay on her behind
She
because
really likes cigarettes, but the problem is I like her too.
Oh, yeah.
yeah,
We're the old friends,
I would
here a long time, yeah.
No, I would try and both of you guys to stop smoking. Is really bad for you, but that's definitely going to be one of those triggers for that variant angina that we had discussed earlier.
Okay.
Okay, and then let me just talk about some side effects and safety, just some things to watch out for.
Okay.
A common side effect is peripheral edema, so that's just a fancy way of saying swelling around the ankles and feet.
Okay.
So if you see any of that, just make sure to be wary of it. This can also lower your blood pressure, like I had mentioned earlier. So it could cause you to feel a little dizzy, maybe a little lightheaded. So just after taking the medication, especially make sure she does this as well. Before getting out of the bed, just make sure to dangle your feet, just to give your time, a little bit to adjust to the medication before standing up.
Okay. So what should we be looking out for, in case we have to call the doctor? What would be concerning?
So if you notice any persistent headache or new swelling in your legs, I would advise you guys to call the doctor. Never stop taking this drug though, because it is for your chest pain. But if you stop taking this medication, it could cause maybe a spike in your blood pressure.
Oh, Okay.
And then if you're experiencing any allergic reactions, like how you would to penicillin,
Excellent.
we're gonna have hives and very unusual reactions. Just make sure to call 911, and if you see she's having this type of reaction, just make sure to call 911. And then if you're also having any pain that's different from your normal, usual morning pain that you've been experiencing, also call 911 and try to get her to see the doctor as soon as possible.
Okay.
So now I'm just gonna, do a teach back method. I know you work in the ER as a physician, but it's really easy to forget a dose, and so I also, before doing the teach pack, I would recommend that you set alarms for your medication, as well as maybe as a pill schedule.
Okay.
Because like I said, the consistency is going to be the most important thing.
Yeah, I can help with that.
Okay. And so just to make sure we're on the same page and make sure that you know all the side effects, what's the most important thing with taking this medication?
So I take it one 5 milligram dose every morning. You said 9 a.m., right? 9 a.m.
Yes.
Consistently, with water. Food is not necessary, but it doesn't hamper it.
And what are you going to avoid?
Alcohol
Yes.
and grape juice.
And grape juice as well.
Wow, two things I love.
Yes. And what are some things that you want to be on the lookout for?
So you said for like dizziness, so dangle my feet before like kind of getting up, and so also, so that I don't get dizzy and stuff. And you said ankle swelling, so when my ankle swelling is one of the things. You said if any new onset chest pain, also call the provider. And I think you said to quit smoking like everybody does. I'm trying.
I know it's really hard. We do have, nicotine patches, other alternative, medication
Trust me,
treatments.
nurse, I've been hearing that a long time. I'm old.
I'm
trying.
No, yeah. But hey, it's never too late to try again.
Yes.
But yes, those are all the important things, and if you could help her out with that as well.
Yeah, we should stop, right? Yeah, we've been saying
Well,
that.
but yeah.
So thank you guys.
Thank
It's
you.
been really great.
Thank
and
you.
Have a great rest of your day.
Thank you.